Hi everyone, and welcome to my presentation on disulfiram, otherwise known as antabuse. With substance use being an issue that has pervaded our society for as long as it's been tracked, especially with alcohol, the use of a drug known as antabuse can be particularly useful to try and reduce consumption through negative conditioning. Like all great strides in science, and particularly medication, antabuse has an interesting origin story. It wasn't grown in a lab, and it was an observed phenomenon at a rubber factory of all places. The chemical makeup of antabuse, or disulfiram, was used originally as a hardening agent for rubber factories in the 1930s. One supervisor of such rubber factory reported that some of the workers at the factory were becoming violently ill when they drank alcohol after work. These reports sadly were not taken too seriously though, and the substance continued to be used for other things. One scientist later even researched the medicine to be a possible cure for intestinal parasites and observed near the same reaction as the factory workers. Another researcher, a Dr. Erik Jacobsen and others from Denmark, was a self-experimenter who is someone who is taking the medicine themselves to observe the effects of it, who discovered the same reaction as the previously mentioned testers when he drank a small amount of alcohol. Following this, disulfiram was finally researched as a cure for alcoholism. In 1949, antabuse was officially entered into the market in Denmark and was used widely and popularly for a while. Sadly, after a time, reality started to hit as to what the medication really was, and the strength of its effect became apparent. While effective, it is hard for people to be willing to take a medication that will literally make them feel worse before they feel better. Antabuse was formally approved by the Food and Drug Administration in 1951 and has continued its use through today, though its use has declined as more medications have been released. Its primary use would be during the initial stages of rehabilitation to help discourage further consumption of alcohol. When speaking to the effectiveness of the drug, it is a well-researched treatment that it shows to be more effective if taken regularly and in compliance with prescribed directions from your physician. The true issue with its effectiveness lies in its compliance rates, as it is understandably not a pleasant medication to take, and often leads to individuals temporarily halting their medication. In fact, research has indicated that when someone is supervised while they take the drug, it enhances compliance with taking antabuse and enhances the effectiveness of it. This is not uncommon when dealing with substance abuse. There is research out there to show that support structures being in place for a person in recovery almost always helps aid rehabilitation, and antabuse is no less a good example of this. Another reason for people to take breaks in the medication is that there is relatively little risk to suddenly stopping the medication for a few days, wait for the desired effects of the medicine to dissipate, and then continue drinking. This, of course, then would be considered a relapse in treatment and is not recommended, as temporary increases in drinking can lead to situations where binge drinking is common and can lead to an increase in health risks. Antabuse is currently only available via prescription from a licensed physician and is initially administered at a maximum of 500 milligrams daily. It can come in pill form and can also be taken as a liquid, as well as a dermal implant. Typically, most people take the drug in the morning in a single dose or in the evenings because it can produce mild sedation. Antabuse is a medication that one can get a prescription for and prevents the body from properly breaking down the toxic parts of alcohol our body naturally tries to fight off. Without this ability, if you consume alcohol, one can experience skin flushing, headache, nausea, vomiting, dizziness, lightheadedness, tachycardia. Even following the cessation taking the drug, the effects can last for up to 2 weeks. With such negative side effects of alcohol consumption, the hope is that the negative reinforcement of getting sick will dissuade any future drinking, or at the least help stop some impulsive drinking behaviors that could happen further along any alcoholic treatment. Essentially, if you are taking this medication and you consume alcohol or anything like alcohol, it essentially gives you an immediate hangover within roughly 10 minutes. There are a host of side effects that are possible when taking this medication other than the intended reaction when consuming alcohol, some of which are increases in acne, some allergic skin reactions, increases in fatigue, headache, possible impotence in males, and a metallic or garlic-like taste in the mouth, according to the American Addiction Centers. As always, one should consult a trusted physician before taking any form of disulfiram and should seek immediate medical attention if experiencing worsening symptoms. Additionally, from the before mentioned source, it is not recommended for people with schizophrenia or other psychotic conditions, cardiovascular disease, current liver damage, allergies to sulfur or nickel, and pregnant or nursing women to be taking this medication. The cost of medication is something that always is at the forefront of everyone's mind when considering getting a new prescription from the doctor. Antabuse is typically seen to cost around $80 for a 30-day fill of the medication, according to the American Addiction Centers. It is typically covered by insurance, but one should always consider their current insurance policy and speak with their doctors to make sure that the medication is affordable and will possibly be covered for hopefully most of the cost of the medication. There is also an implant that is available, but is only currently available within one center, which is the Philadelphia Addiction Center in the US. Otherwise, you have to go overseas into Europe to try and get this medication, and can cost upwards starting at $1,500. So with this presentation, one can see that Antabuse can be a very powerful deterrent to alcoholism and can be a very effective tool, but it is one that is not without risks and should be well researched and talked to with your physician. Thank you very much for listening to my presentation, and hope you have a wonderful day.